Examination of oculomotor, trochlear, and abducens nerves, that is cranial nerves 3, 4, and 6, can be performed at the bedside or in OPD. A lesion of the third cranial nerve produces impairment of the eye and lid movement, as well as disturbance of pupillary response. The pupil is dilated and fixed to light illumination. If the torch is shined in the affected eye, the contralateral pupil constricts, however, there is an absent or impaired response in the illuminated eye. When light is shown into the normal eye, only the pupil on that side constricts. Ptosis is the drooping of the eyelid over the pupil when the eyes are fully open. Since the levator palpebrae muscle contains both skeletal and smooth muscle, ptosis signifies either a third nerve palsy or a sympathetic lesion and is more prominent with the third cranial nerve lesions. To examine the ocular movement, ask the patient to steady his head and ask him to follow an object held at arm's length. Observe the full range of horizontal and vertical eye movements. It is necessary to note any malalignment or limitation of the range of motion of the eyeball. Also, make sure whether there is a presence of any diplopia or not. If possible, note the vertical overlapping or horizontal overlapping of the images. Vertical overlapping of images in diplopia signifies the superior oblique palsy, which might be secondary to the fourth cranial nerve palsy. Similarly, horizontal overlapping suggests third or sixth cranial nerve palsy. Examination of conjugate movement is done by noting the movement of both the eyes simultaneously together. During the examination of the cranial nerves 3rd, 4th, and 6th, it is necessary to look for the nystagmus. This is an abnormal jerky movement of the eyeball. A slow drift in one direction is followed by a fast corrective movement. Nystagmus is maximal when the eyes are turned in the direction of the fast phase. Nystagmus direction is usually described in terms of the fast phase and may be horizontal or vertical. Test is for other eye movements, but remember that physiological nystagmus can occur when the eyes deviate to the endpoint of gaze.